Welcome back. Welcome back to forpay.org. This is Consumers Dr. Bengala. Thank you for joining. Why the healthcare keeps rising. That's the best topic for today. Why the healthcare keeps rising. Reason is simple, folks. It's very simple. I'll give you one by one. Okay? Again, I appreciate all you guys for listening to this. Number one, consumer. Consumers have been ignored all this time in healthcare. Even now, the consumers have been ignored all this time because consumers control the costs of the healthcare. They were never given choices. Everybody, including starting from the several insurers, representatives in Washington, and everyone has been ignoring the consumer. The reason why I say the consumers are the only segment of the sector will lower the cost. Look at any other sector, folks. Consumers demand affordability. Consumers demand transparency. And consumers demand incentives and rewards for them to shop. They have been ignored consistently all the way through. The time has come. You cannot ignore the consumer anymore because the technology is on the consumer side, folks. Technology is on the consumer side. There's no way we can have this healthcare system, so-called Canadian and British healthcare system, which is a two-tier system, and people who have it, people have not. So basically people will choose. People have the money. They can go anywhere and they can pay cash and get the care. But people who don't are trapped in the system. So Americans will never go for the two-tier system, folks. Americans want freedom in healthcare. And technology will fulfill that role. Wait and see. The technology is going to disrupt the healthcare industry as I see it. And I have no doubt, as a consumer's doctor, I'm on your side, folks. And I will try everything in my power or my capacity to drive the consumers to the forefront. That's why I named it forpay.org, which is a nonprofit oriented for consumers. And we will provide you the best health insurance and best savings, health savings tools, whatever we can gather. That's number one. Number two, folks, are the providers. You can't blame the providers because that's the way it is structured, folks. In 1930s, we started this concept of, we used to pay cash. Those days, early 1900, we used to pay cash. We used to have doctors make home calls. Those days were good old days, and people were happy, seeing their doctor. And now we have telemedicine and telehealth. So it's almost the same, folks. Your doctor is on your mobile phone. He can see you online. They don't have to visit you physically, but they can gather all the information what you need from your records, starting from your records to the health information they need. They have all the vital signs they need. And these gadgets are all, every time you go to see a doctor, they want to see your vitals. So you can get that vitals on tele, pulse, blood pressure, temperature. It's easy, folks. It's not a impossible task. So providers, you can't blame the providers because that's the way the system has been set up. So the insurers have taken the forefront. So the doctors had to build insurance companies, and facilities had to build insurance companies. That's the way it has been. So all along we have been focusing on providers to be more transparent. Unless consumers demand it, it will never happen, folks. One good thing about COVID, now the consumers want telemedicine, telehealth. They want to see their doctors right sitting at home. They don't have to go and sit in the lobby waiting. They don't have to be in the waiting line. And you will get the prices before you even consult your doctor. You know exactly how much it's going to be charged, and you pay as you get the care. And even folks, I want you to warn you, even if you have a deductible health insurance, if you have traditional health insurance, don't even bother. So deductible health insurance, if you have to pay, just pay. And I'm pretty sure you'll get your money back. So, but you're saving tons of money, folks, tons of money. And you're shopping. Who is reasonable? Who can see you for, good amount of time at a reasonable price. So the providers' attitudes, things are changing slowly because of the technology, folks, technology. So providers are becoming more transparent. They're giving prices up front, and they're also giving you the necessary tools, what you need. They can prescribe, they can send you to a lab, all that can be achieved. So the providers are the second common reason why healthcare costs have been rising, because they have not been transparent, they've not been, and the trend now, healthcare is going in the opposite direction. That needs to change, guys. So these medical group days are numbered. These medical groups, the doctors want to be independent. They want to compete. And what they're doing is this hospital consolidations and physician mergers, which is not good. You need more competition. And doctors love competition, folks. Believe me. Doctors they compete. By nature, they compete. So I would like to see more and more doctors becoming independent, and they can share their calls with colleagues, things like that. So the providers are very important. That's and number three, diagnostic centers. Diagnostic centers, like you're talking about CAT scan, MRI, nuclear imaging, you name it, folks. All this radiology service, all these services, again, they're under the shield of insurance. Very first thing, they want insurance company before they can. You can be stubborn. As a consumer, you could be stubborn. It says, I'm only paying cash. That's it. I am paying cash. And I will recover my money from my insurance company or whatever it is. If you have a deductible, you have people have 3,000, 7,000, up to that amount. You have to, no choice, but you're not lying. You're basically paying cash because you have a deductible insurance, and you don't need to give insurance upfront. So when you pay cash for all these diagnostic services, the prices drop by 70%, folks. 70 to 80%. I'm telling you. You save lots of money by doing that. And you have no choice anyway. If you have a deductible, you have to pay cash. And keep all the receipts, guys. Keep all the receipts. This is where you come out ahead. If you can keep all the receipts what you spent on your health, you can recoup all that money. I'll tell you how you can recoup. So number 3 are the diagnostic centers. Anytime you go to even the lab also you can pay cash, folks. You can make lots of money. Even lab services, you'll be surprised, the day will come you can have your lab test done sitting right at home. I can bet you it's coming. You can draw the blood. You don't even have to draw the blood. Little prick, the blood which is taken from a micropipette, and they'll give you the lab results right on your phone, man. I'm telling you, the labs, you can do it sitting right at home. You can get your CBC and metabolic. I'm talking about simple tests, folks. CBC and metabolic panel. It's not a difficult thing to do. When you can do your blood sugar sitting at home, you can do the lab sitting right at home. So that's diagnostic. The next, 4th or 5th. So the next is last, but actually it is probably the most important thing, insurers. Insurers concept, this is a 5th one. Insurers concept originated in 1930s, was a brilliant idea. It started in Houston by Baylor. As people could not afford to pay cash, they came up with an idea of having monthly premium, and in a way you get hospital coverage. Baylor hospitals numbers went down and people could not afford. That's how I ended up having an insurance company. Then the World War II came in and inflation hit. Things started to roll, and Kaiser model came in 1950s. So insurance was a brilliant idea, but that needs to be reformed, folks. Here we are in 2021. The insurance companies need to be reformed. Insurance companies is an excellent idea, but they have to be consumer driven. Right now, insurers are not consumer driven. For insurance companies are not, they don't have to, listen to the consumer, and they have no incentives to lower the costs. They don't have any incentives to lower the costs, whereas consumers want to lower the premium. When consumer demands a lower premium, they will get it. I'm telling you, when consumers demand lower premium in insurance, yes, they will achieve it, one way or the other, folks. So I believe the time has come for insurers to be consumer driven rather than from the Washington folks. We want total control on our healthcare. I believe healthcare needs to change the direction. Instead of having this premium-based, mandated coverages like Obamacare, that can sustain for some time, but I believe the consumers will demand more, because with mandated care, you're controlling an individual. You're telling them where to go, what to do. That's not going to work, folks. In the long run, it's not going to work. If somebody tells you have to see this doctor, this group, this hospital, it will never work. So consumers finally decide they lower premiums, deductible health insurance, and they want to save and put money aside into their own savings account. So they will be able to take care of the payments, pay as you go. I think that's probably the best model we can see. And American economy is a free enterprise system, folks. American economy is driven by the consumers. Don't tell me healthcare is going to be any different. Consumers have the right. I've been looking at the consumer reports. There are so many things available for the consumers to lower the cost of the healthcare. Keep watching the consumer reports on healthcare. I've been looking at it. It's an interesting. So consumers will have all the reports available on their control. So they will demand more affordability in premiums. They will demand more affordability in treatments, and they want more transparency. This is what the beauty about. They want more transparency before you even get the care. They want to know how much it is. And finally, the sixth one, this billing system, man. This billing system has to go away. There's no way this billing system is going to help us because people are declaring bankruptcies. They're not able to make payments. They need to be reformed. Congress has been looking at surprise medical bills. Surprise medicals, we already know that a lot of people are declaring bankruptcy. They're losing their assets. They're losing their home. They're losing, and they come after these folks to collect the funds. It's not acceptable, folks. These billing systems and these middlemen in the healthcare delivery, they need to be gone. These managed care organizations have no place in healthcare. Managed care organizations, there are few people making money in the middle. That needs to go away. And the same thing with billing companies. Billing companies are the middlemen. And I'm sorry to say, but again, they're doing the job, but ultimately, consumers will end up paying as they go because we are not there yet, folks. We are not there. But ultimately, we will achieve where consumers will pay as they go receive the care. Now, the concept is you don't have to. You can pay and you can collect the funds. As long as you have the receipts, you can collect all those funds. The thing I was going to talk to you, how do you get your funds back? Okay, this is what it is. When you set up a deductible health insurance, you qualify for a health savings accounts. A lot of folks have average income of, 55,000. If this is where the tricky part is, folks. I was looking at the healthcare.gov, and if your income is about 55,000, then your insurance, basically what it says is the contributions you make to a health savings are not deductible. That's such a stupid thing to have. If your income is over 55,000, then health savings, whatever you contribute, you're paying from your pocket. That's not right, folks. You need to increase like 200,000, whatever. But what I'm saying is that's why a lot of folks don't want to buy the health insurance. Instead of buying health insurance, they're buying health savings. Actually, if I'm independent, I own my own business, I'm self-employed, I would rather just pay for my health savings and not even bother with the health insurance. That's what I would do, because if I'm healthy, I can take that risk. Man. Because if they don't allow you to take as an expense, so I will make it as an expense and pay for my health savings. I can write off as an expense and buy the health savings. $10 a day, folks, for an individual, $20 a day for the family, $300 a day for a month for the individual, $600 a month for the family. And you're talking about yearly, you're talking about $3,600 for the individual and $7,000 to $8,000 for the family. As long as you contribute every month on a regular basis, you will come out ahead, folks. I'm talking about in 10 years. I'm talking about in just 10 years. You will have 80 to 100,000 for your family. And you can, whenever, even if you reach to Medicare, you should be able to self-sustain and you don't have to give up on your Medicare. A lot of folks don't even have those options. Now, if you have the health savings, you will not have to give up on your Medicare policy. So I strongly encourage you guys to have health savings accounts. Well, folks, thanks for listening. I'll continue to talk about healthcare. This is the reason why the healthcare premiums have been, because consumers have been ignored. The time has come. If the consumers take charge, they will be able to control the costs of the healthcare. As long as the consumers are in charge, they are the only one who can lower the cost. Nobody in Washington can lower the cost. I believe the time will come. Time will tell. I really believe consumers will ultimately achieve the goal of having a total control on their own health. It will happen, folks. Just a matter of time. Anyway, thank you for listening, and we will see you in the next episode. This is forpay.org. If you like my point of view, you can hit the like button, subscribe, share, contribute for forpay.org. Folks, this is for you. This channel is for you guys. We'll see you in the next episode. Love you. God bless.